The Bureau of Justice Statistics stated an estimated 44% of state inmates and 39% of federal inmates reported a current medical problem other than cold or virus. Today, Medicaid is not offered to incarcerated individuals. And if you had a loved one that was in jail or in prison, you would want them to get the proper care that they needed. So today I'm going to be telling you about the issue of Medicaid not being offered to incarcerated individuals and how the Medicaid Reentry Act can help fix that issue. Under the Inmate Exclusion Act, Medicaid is not offered to incarcerated individuals. An article written by Marin Olson and others explains that the Social Security Amendments of 1965 prohibited the use of federal funds for medical care provided to an inmate of public institution. The Social Security Amendments of 1965 decades later became known as the Inmate Exclusion Act. And under this act, they use the language inmate of public institution, which means that it's anybody that is held in a jail cell gets their Medicaid taken away from them. So if someone was arrested and they couldn't afford bail, so they stayed in jail to await their trial, in that time period they could get their Medicaid taken away from them. And the National Association of Counties says that these individuals are presumed innocent and should not have their Medicaid taken away from them before they have been convicted, because that goes against the Constitution under the 5th and 14th Amendments. According to Natasha Kami of the Commonwealth Fund, prisons and jails are required to provide health care to their inmates, but there are no guidelines to this health care, and staffing and spending is left up to states and counties, which can be a lot because the United States has the highest incarceration rate out of any country in the entire world, at about 10.6 million admissions to jails and prisons every year. Chronic disease is also very high in prisons, with diseases such as HIV, diabetes, hepatitis, and much more. And in 2009, an estimated 58% of state prisons and 63% of jail inmates met the criteria for drug dependence or abuse, in comparison to just 5% of the total general population over the age of 18. So when you combine the amount of people in jails, the likelihood of disease, the drug dependence, and the lack of medical care, you just get a big cycle of unfair treatment, sick inmates, and an increase in recidivism. Recidivism is when an inmate goes back to jail after they have already been released. But there is a solution to this problem. In May of this year, the U.S. House of Representatives presented the Medicaid Reentry Act in the COVID relief package. According to Tommy Baldwin of the Baldwin State Senate, this act is legislation expanding access to addiction treatment and other health services for Medicaid-eligible individuals 30 days prior to their release from jail. Baldwin also stated that individuals are 129 times likelier than the general population to die of a drug overdose during the first 2 weeks after release. And if an inmate got help with their drug addiction before they were released, this number would go down tremendously. 125 national organizations wrote a letter to our senators explaining that with the Medicaid Reentry Act, we would use less emergency departments, the health and well-being of inmates would increase, drug dependence would decrease, recidivism would decrease, and the overall well-being of our society would improve. But some people don't think that we should offer Medicaid to prisoners. The NCBI said that such an appeal, long advocated by the American Bar Association, would permit jails and prisons to enroll inmates in available insurance and bill for these services. This would result in a substantial infusion of funding for correctional health care, which they are not wrong because the healthcare cost is already substantial. The Institute of Healthcare Policy and Innovation stated that in 2011, $7.7 billion was used for the health care of incarcerated individuals. But with the help from the federal government, states and counties wouldn't have to pay so much of that money, and they could use that money on other important things. Also, it would increase our taxes slightly, but I think all the good it would do for our inmates and our society would outweigh this minor inconvenience. Today, I talked to you all about the issue of Medicaid not being offered to incarcerated individuals and how implementing the Medicaid Reentry Act would help fix this problem. If you were interested in what I had to say and wanted to help, you could contact our federal legislators, our local senators Tim Scott and Lindsey Graham, or by sending in an online petition to our House legislators. Medicaid not being offered to our prisoners and our jail inmates is unfair and something should be done about it. Turkish writer Murat Eden once said, "An honorable man is fair even to his enemies." Thank you.